Holiday Simmons, who's the Director of Resilience and Healing at the Campaign for Southern Equality, and will start us off with a moment of reflection.
Thank you so much, Jazz. Thank you to our partners and to my colleagues at CSE. Again, my name is Holiday Simmons, the Director of Healing and Resilience at the Campaign for Southern Equality. My pronouns are he, him, and his, and I make my home in the Muskogee Creek territories, now known as Atlanta, Georgia. And I would love to guide us in just coming into our bodies a little bit before we start this town hall and this conversation. But first, I want to invite you to our resilience workshop that we're having tomorrow for those of you who want to gather again and just have some space to breathe, to reflect, to share open conversation, get things off your chest. It'll also be a space with a little bit of more information sharing, like you'll get here tonight, in terms of, hands-on resources. So if we could just advance the next slide just to show, yes, so that's tomorrow, Friday the 30th from 1 to 2. If you want to sign up for that, that's you can go to southernequality.org/NC Wellness Workshop. If I saw in the RSVP list that there are a few other practitioners here, social workers, counselors, yoga practitioners. So first of all, thank you for your work in supporting our communities and our youth. You are especially invited to come tomorrow or email me. I will drop my email in the chat for any parents, young folks, or practitioners who are not able to come tomorrow but want to continue to engage in our work as it relates to supporting our young people and each other from a mental health and spiritual health perspective. Please, you're encouraged to email me and get in touch. So I hope you'll join us. And without further ado, I just want to guide us in a few breathing exercises before we open our conversation. We know that the more present and centered we are, the better that we can have choice and show up for ourselves and our families. So our intent, while we can't always control what's happening with the people in the State House and the folks out here, we want to keep pushing for change out there while also learning ourselves and regulating our own nervous systems. So that is the intent of this. And so I encourage folks, this will just be a few moments to just get comfortable in your seat, or if you're up making dinner, if you're driving, wherever you are, just bring awareness to your body's connection to the ground. And I encourage you to keep taking big cleansing breaths. You might hear me exhale. If you hear me, may that be an invitation to you to take a deep breath. And go ahead and wiggle your toes on the ground. And we're just going to bring our awareness up from the bottom to the top, wiggling our toes, becoming aware of this incredible thing called gravity, tethering us to this incredible planet that we get to take care of. If you want to place your hands on your knees, if you're able to, if not, you can just intention that if you're moving around or driving, as we bring our awareness up to our knees. Take a good cleansing breath there. Our foundation, keeping us grounded and rooted, remembering our principles. And taking two hands, if you'd like to, and bringing them up to your belly as we remember our center, particularly our belly button, our original life source, our source of intuition, that gut feeling. Taking a deep breath there. And bringing both hands, if you're able and wanting to our hearts. And really feeling that heartbeat for a moment. Remembering the rhythm that we're all a part of. And we're just reminding our body that we're so much more than just our thoughts and our strategies. We're a whole system of information. And finally, bringing our heads, if you're able and wanting to our hands rather, to our foreheads. Some people call this the third eye. And just taking a couple deep breaths there as we kind of massage that frontal lobe, the source of where all this complex thinking, as we try to sort out all of this foolishness, really, as we sort it out and as we love on each other. And I invite you to release. Shake it out if you need to. Take a sip of some water, whatever you have, to allow that to metabolize. Thank you for centering with me. Thank yourself for being present. And again, I hope you can join our wellness workshop tomorrow. And if not, I'm going to drop my email in the chat if you want to keep in touch with our Healing and Resilience program or me. And I'll pass it on. Thank you.
Holiday, thank you so much for helping us get grounded and also connected with each other. We are honored now to begin the part of the town hall that will focus on walking all of us through the gender-affirming care ban bills that are currently moving at the North Carolina legislature. We want to say a huge thank you to Ivy Johnson from the ACLU of North Carolina, who I'll pass the mic to and who will walk us through a legal analysis.
Hi, everyone. My name is Ivy Johnson. I use she, her pronouns, and I am a staff attorney at the ACLU of North Carolina. And I am beaming in from Saponi and Occaneechi land, which is now Durham, North Carolina. So this is going to be a bit of a right turn from our wellness exercise, and I'm going to get into the nitty-gritty of these bills. And I'm going to start by saying law school is basically 3 years of learning how to speak a different language that we refer to as legalese. So if I slip into that, if someone would please tell me that that's what I'm doing, and I will do my best to just speak the one language of English. So with that said, I will get started talking about House Bill 808. And this is a bill, it has already been ratified by the House and the Senate and has been sent to Governor Cooper's desk. So what that means is the House and Senate have already voted to pass it. It is now up to Governor Cooper to sign or veto. I think we all anticipate he will be vetoing. He has 10 days from the day that it arrives at his desk before he has to do something with it. And this bill prohibits all medical gender-affirming care. And I'm saying medical here as a quote unquote term of art that is to be distinct from mental health care. So the bill specifically carves out or specifically says that any sort of mental health care by a licensed mental health care professional can continue. It is the medical care that is now prohibited. And specifically, the bill sort of goes through a number of definitions of what is going to be prohibited under this bill. And it is sort of puberty blockers, hormone therapies, and surgical care. Now, I think, let me just double check, right. So the bill right now will take effect August 1st. In order for that to happen, Governor Cooper would, I mean, if he signs it, then it takes effect August 1st. If he vetoes it, as we anticipate, the House and Senate will have to have a veto override vote, and they need 3/5 of both houses to override the veto. And if they're able to do that, the bill will take effect August 1st. The bill also says that if you're already under care prior to August 1st, if care has been established prior to that date, then you get to continue that care. So with that said, I should say, the bill says if you are under a specific course of treatment, that course of treatment will continue. course of treatment is a term of art in the medical community. And luckily we have healthcare providers here, so they can explain that in more detail. But my understanding of the bill, and after speaking with some other folks about the bill, we read that to mean if you are currently on blockers, for example, and waiting to begin HRT at the appropriate time per your medical care provider's instructions, and that an HRT does not begin prior to August 1st, that is considered a separate course of treatment. So if you would then be prohibited from continuing or from moving up to HRT from puberty blockers. Those are separate and distinct in terms of how that is defined medically and how it's defined in this bill. So that's important to note. It's more than just starting blockers, starting a course of treatment with your doctor that has not yet initiated these types of medications. Right, and there's the last portion of the bill that prohibits state funding. So this means essentially this is a very vaguely written section of the bill. It says no state funds can be used directly or indirectly in furtherance of this type of care. It is very unclear right now as it's written if that prohibition will impact people who are already receiving care. If someone is already receiving care from the UNC clinic, for example, can they continue that care because they are grandfathered in under that August 1st provision at UNC? That's unclear. That will likely have to be figured out in the courts and will likely depend on sort of general counsel at that clinic. What is also unclear is this sort of indirect use of state funds. It's unclear whether that means, let's say Duke, for example, Duke has its own clinic. Duke is a private hospital. Does Duke receive state funds in some portions of its private hospital? Probably, I'd be willing to guess. I don't know. Maybe one of the medical providers know that for sure. But if those state funds are not going directly to their gender clinic, but it's going to like a cancer clinic, for example, or the VA, for example, but it all falls under Duke's hospital or Duke School of Medicine. What is unclear right now is whether that means care is prohibited to continue at the gender clinic because they are receiving indirectly through Duke School of Medicine some sort of state funding. And that's another thing that will likely have to be litigated in the courts. And if we can, right, so the last section is the bill is the civil penalties for providers. That means if someone, a minor who received gender-affirming care, decides later that that was not the right decision for them, then they have, if they're still a minor through their parents, the right to initiate a civil suit against their healthcare provider. And for, I think, 25 years after they turn 18, they're allowed to initiate a civil suit against their healthcare provider if they later realize that that was not the right choice for them. So that's all very bad. And the other penalty for healthcare providers, if they are found to violate this law, is that that would be considered misconduct and they'd go to the medical board and lose their medical licenses. And that is not what we want. We need as many healthcare providers providing this care as possible. So that's the status of this bill. If we want to go to the next slide for 631. So this is a bill that has not proceeded as far through the legislature as 808. It was passed in the House. I can double check that, but was just sent back to the Senate for a concurrence vote, but has not yet been calendared for that. So it's not as far along as 808. With that said, I think our friends over at Equality NC are going to talk more in detail about what to expect in terms of that bill's path forward. But this bill prohibits all state funds from being used for any sort of gender affirming care. And again, that's the medical care, not mental health care. And that is includes, it has, again, this is another bill that is vaguely written, as our legislature likes to do. And there's a provision that says if a healthcare provider has a contract with any public healthcare facility, then they're prohibited from providing that care. And it's unclear right now if that means, is that a private practitioner, someone who has a private practice but has admitting privileges at a UNC hospital, for example. Does that count as a contract for purposes of this bill? I would imagine that was the intent of the bill, but it's something else that we're sort of having to figure out. And this bill also would mean that anyone who is on Medicaid would not be able to use Medicaid to cover treatment, even if they receive that treatment from a private practitioner. Currently, both this and House Bill 808 carve out exceptions for the state teacher and employee health plans, and that is because just last summer there's a 2022 ruling in a case called Cadell versus Falwell. Maybe that was a Freudian slip of sorts. Cadell versus Falwell, brought by Lambda Legal, challenging a state law that said the state employee and teacher health plan could not be used for gender affirming care. The court in that case said that that was unconstitutional. They enjoined that law. When you hear that a law has been enjoined, it basically means that the court has stopped it from taking effect. So that law has been stopped and found unconstitutional at the trial level. And because of that order, the state employee and teacher health plans can still cover gender affirming care. And again, we're not sure right now whether people who have already initiated care prior to August 1st, who are grandfathered into continuing that care, whether they're sort of grandfathered in with this state funds prohibition. That's unclear right now. And I think will largely come down to the lawyers for the doctors. And again, we want to make sure that there are as many healthcare providers providing this care as possible. So you sort of have to tread lightly there. So that's where that bill is at. If we go to the next slide, I think it goes through more what these bills don't do. I've already covered some of this. Both of these bills specifically target minors. So if you're 18 or over, you get to continue your care. And unlike some of the bills in other states, like Arkansas, for example, their bill prohibited medical professionals from advising patients to seek treatment in other states where it was legal. Ours does not do that. You are still, if you are a minor seeking care, have every right to go to a state where that is legal to get that help, to get that care that is medically necessary. There's nothing to say that you can't help someone that seek that treatment elsewhere, and there's nothing to say you can't tell someone to seek that treatment elsewhere. And I do think it is important to note that neither bill prohibits mental health care from a licensed mental health professional. They are specifically prohibiting this sort of the blockers, HRT, and surgery. And I'll just say, I know there are probably a lot of questions about litigation and a case that might be filed. Lambda Legal, which is the leading national legal organization, they focus solely on LGBTQ legal issues. They've brought similar suits around the country. They are currently gathering stories of folks in North Carolina. And so if you are interested in that, you should reach out to them directly. ACLU.
Screen, there should be 3 little dots. Does it allow you to?
ACLU of North Carolina, we are looking into some of these other bad bills, like the Parents' Bill of Rights, like the trans athlete ban, that you all will hear more about from Equality North Carolina. And so if that's something that you're interested in, you can feel free to reach out to me, and we'll figure out how to put my email in the chat, so you can talk to me about that. And these are the states. Jasmine said that right at the top. We've had a number of rulings in cases in other states just in the last like 24, 36 hours. In every state where the litigation has reached this point, these laws have been enjoined as likely unconstitutional. I do want to make sure that folks understand what that means. That does not mean that they have been found necessarily definitively unconstitutional. Courts tend to enjoin laws if they significantly change the landscape, for example. So this is a huge shift in what is or is not allowed in terms of medical health care. So courts are more likely to enjoin that type of law and say that it is, they need more time to look at it, basically. But I think these 6 states, they've had their laws stopped. I think those are wins. I think especially right now, given everything that we are facing, we have to take all the wins that we can get. And so one last thing I do want to touch on really quick is just sort of the timing of the vetoes and the overrides. Because like I mentioned, Governor Cooper has 10 days to decide whether or not he's going to veto these bills. And after that, the legislature would have to hold an override vote. It is not sure. It's not clear. That all depends on the legislature's schedule. You know, it's known that it can be, the legislature does not meet as frequently in July. So it is possible that the veto override vote would not happen for several weeks, which might seem good, but that could also mean that if these vetoes are overridden on August 2nd, for example, the law would immediately take effect. And there would be a lapse of time there between when the law takes effect and when some potential lawsuit might be filed. If the override happens immediately and the law is ratified, whatever passed prior to August 1st, then a lawsuit could be filed before the effective date of August 1st, and potentially some sort of a court could enjoin it from taking effect on that August 1st date, meaning it would not go into effect on that date. So there's some gamesmanship happening in terms of how this will all play out. So that's the legal side.
Ivy, thank you so much for walking us through both what the letters of the bills say, but also the many questions surrounding them, as well as previewing litigation strategies. We're now going to turn things over to hear from gender-affirming care providers. First, Dr. Izzy Lowell from Queer Med, who will introduce themselves and share a bit about Queer Med's work, and then Natalie Frazier from Planned Parenthood South Atlantic. And we'll also call out that there's amazing providers who are on this call with us, who we won't hear from tonight, but who are out there providing care and working to ensure folks have as much access to care. But turn things over to Dr. Lowell now, and then to Natalie from there.
Hi, everyone. I'm Dr. Izzy Lowell. There we go. My camera's working. I'm Dr. Izzy Lowell. I use she, her pronouns. I'm the founder and primary physician for Queer Med. We cover 25 states in the South via telemedicine, including North Carolina. Thanks so much for having me on this call. Can you guys see the screen? Do I need to share anything, or can you still see the presentation on the screen?
We'll get the slides back up in a second.
Okay, great. That slide has most of. Oh, there we go. Can you go to the next slide? There. Yeah, so very briefly, I won't take up a lot of time, but we are blocking spots for North Carolina patients under the age of 18 to get people in before the August 1st deadline, so that people will be able to continue care after that time in whatever way we can. We are helping people travel out of banned states to states where we can see them for virtual visits. We're getting really creative. We're seeing people, if they're like, we saw a patient on a layover in Boston at Boston Logan Airport, somebody was on vacation, taking a trip. We're just doing everything we can to get people in before these deadlines. So if you have a child who needs to get care, please reach out to us as soon as possible. What you do is go to queermed.com, register there as a new patient, and then reach out to us either preferably by a portal message, that's the most secure, or email, and we will get you into one of these spots. They can't be booked online. We have to authorize them to make sure that only people who really need them are getting them. But we'll do everything we can to see all of the patients who need us before August 1st, and then we can continue your care after that. I will stop there and take any questions specifically for me from people, and then not take up any more of your time.
If you have questions for Dr. Lowell, please put them in the chat and our team will make sure they get to her, and we'll turn things over to Natalie from Planned Parenthood now. Thank you, Dr. Lowell.
Thank you all.
Hi, everybody. I'm Natalie Frazier. I am a certified nurse midwife, and I'm the director of the gender-affirming hormone therapy program at Planned Parenthood South Atlantic. We are a Planned Parenthood affiliate with health centers in 4 states: West Virginia, North Carolina, and South Carolina. We have 9 health centers in North Carolina. We do gender-affirming hormone therapy for minors and adults in all of our health centers. We see minors with parental consent in all of our health centers. So we, at Planned Parenthood are not strangers to dealing with bans on healthcare that we provide. And just like any of the other bans that we're dealing with, we're going to continue providing this care in compliance with the law as long as we can. Our policy team is also working with Equality North Carolina and the ACLU to kind of fight these laws and defend our patients. And we're just going to keep trying to center our patients and do what we can. We're not entirely sure how, the law is going to impact our care in North Carolina, depending on that state funding law. So there are a lot of questions that have to be answered, and we're, reviewing all of that. We do have health centers in Virginia and South Carolina as well who can see patients, and we can provide care via telehealth. So we have some ways that we can make some adjustments. We also have a wonderful patient navigator, Aster, who's on the call somewhere, who can help to navigate patients and give them care where they can be seen. So, we're just going to keep making adjustments and doing what we can. So we also will make extra slots for patients to be seen for initial visits. I think right now they had our number up on the slide. If you go to our website, you can get information about care, but you do have to call to make an appointment. If you have extra questions, then they'll get you in contact with a patient navigator so we can get, whatever information together or kind of help you access care however you need to. Right now, initial visits do have to be done in person. For minors seeking hormone therapy. That may be adjusted as we try to get more patients in, but that's the current policy. So that's just what to expect when you call now if you do need an appointment. And so, yeah, I will stop there and answer any questions that come up in the Q&A.
Thank you so much, Natalie and Dr. Lowell, for that, and to all the providers out there who are working to ensure access to care. We're going to shift gears right now and hear from our incredible colleagues at Equality North Carolina, who will share a political update as well as action alerts, so that all of us can stay as engaged as possible as the political process moves forward.
Thanks, Jasmine. Good evening, everyone. My name is Rebby Kern, and my pronouns are they, them, and theirs. I'm the Director of Education Policy at Equality North Carolina. I'm based in Charlotte on the lands of Cherokee Nation. I also have a cat in my lap, so you might meet him too. That's Big Guy. He's great. Emotion regulation. I'm joined today by our Executive Director. Kendra, would you like to come on and introduce yourself as well?
Yeah, thanks, Rebby. I'm Kendra, she, her. I'm based in Durham and not delighted to be here, but happy to be providing information. I wish we weren't in this situation, but we're going to keep fighting.
Thank you. So you heard quite a bit from Ivy already in regards to the healthcare bans that are moving. So I won't talk more about those. That's pretty clear. Well, what I will say about Senate Bill 631, because that was named, something surprisingly unique is taking place. While the bill was sent back to the Senate for concurrence, it's actually been assigned to Senate rules, which could mean many things. For the bills that are already headed to the governor's desk, after the concurrence vote took place, they moved along. So I don't have the clearest answer for you, but I can offer a few ways that what could happen. Also naming that next week, the NCGA is going on break. Somebody dropped in the chat that they'll be back in session the week of July 10th. We heard that maybe as a way to focus on budget, we might not hear from committees after the break, though another bill has been assigned to education following the break. And so we are unsure about what that means and what that looks like. It could be that House Bill 808 fulfilled a need that they were seeking. It could be that Senate Bill 631 could go to Senate rules and stay there and die. It could mean a variety of other things. We know very late in the session, and a number of bills on the slate of hate have already gone to the governor's desk. Kendra, would you want to add anything based on what you've seen historically with this body?
Yeah, I'll just talk a little bit about this session. I think all bets are off. What we've seen typically has been completely different this go round. So just to add to your scenarios, it could be that 631 does die in committee. It could be that it's added to another bill. There's all kinds of things that could happen. I do want to talk a little bit about the veto, though, since it was brought up. For these bills, the governor typically is expected to veto, but he typically waits to the last possible minute in order to give himself the opportunity for the law to be sort of extended and not take effect at that given date. The session will continue, so I want to just add that we had hoped that the session would be out by July 15th, but that is not the case. They have not really taken up the budget, which is why they may not have many committee votes and move into negotiations around that. So there is still time to push back against these bills, and we'll talk a little bit about action steps.
Thanks for that, Kendra. I tell you what, I've learned a lot about procedural actions in this session. Somebody, I think Ivy mentioned law school, and this session is a good practice of that. Before moving on, I do want to name and honor that our work is not done here. Even though these bills, 3 of these are heading to Governor Cooper's desk, there's still a lot to do. Governor Cooper also needs to hear from you that his veto is encouraged, and continue elevating why these bills are so harmful to our community. Additionally, because Senate Bill 631 has been added to committee, if it does move, there might be another opportunity for public testimony. There might be more opportunities to contact the sponsors of this bill. On the next slide, I did go ahead, I'll talk about Senate Bill 49 in just a moment as well, but was there the next slide? Okay, go to the next one. I mix these up. Thank you. So of Senate Bill 631, the primary sponsors are Senators Corbin, Kravick, and Sawyer, and the counties that they represent are here. If you are coming out of any of these counties, this is a great time to flood their inboxes and remind them that this slate of hate has no place in our state. And again, Governor Cooper needs to continue hearing your voice. And then if you could go back a slide, I think I can talk a little bit more about the actions. We know that over the last couple months, and particularly the last 2 weeks, as these bills have been moving, many students, family members, educators, medical professionals, and so many more have come out against these bills. There have been a number of ways to do that through our mass mobilization. Some of that has looked like telling your story in op-eds and media interviews as a way to ensure that your story is heard. These bills don't represent what North Carolina is, who we are, and what we believe in. So ensuring that these bills are not overwriting our stories, our existence, and our brilliance, these stories can still move forward regardless of what's happening at the General Assembly. We really honor so many of the silent protests that have gone through the General Assembly building on the days of floor votes. It's making a difference. People are talking about it, and it's a great way to be seen in the building if getting to rally is available to you. Additionally, we've heard from young people. These bills are directly impacting the lives of trans and queer young people, and yet their voices are often even more silenced day in and day out on these issues. So we honor all of the teenagers and young people that have come out to vulnerably share their story in testimony in front of these senators. Some of you are here tonight. I see you and I thank you. Your stories will not be erased. In addition to contacting your legislators, we do offer action hours. We tend to cater these to however bills are moving that week. That also includes thank yous, to ensuring that your friendly elected officials hear that their votes against these bills are making a difference from you. These action hours are happening every week, Wednesdays at noon. And you can get all of that information on our website at equalitynorthcarolina.org. If you're a medical professional, we also need to hear from you. I'm dropping a few links here in the chat, and if you're watching in the recording back, I'll try to verbalize these and you can get all of this on our website. But if you would like to speak out against any of these bills, the link is there to sign up. Taking action and attending our action hours is here. Our phone to action page is useful for you to identify who your legislators are based on your address, and then contacting them against the slate of hate. Again, a thank you to our friendly legislators is always welcome as well. And then here, for all of the medical professionals out there, we already have hundreds and hundreds and hundreds of medical professionals that have signed on against the slate of hate. And there have been so many more actions that have been named here. Those are just a few ways. I'm sure I'm forgetting so many more. We are at Equality NC on all platforms. Kendra, what else am I missing here to let the folks know?
So I did want to, if we can go back to our first slide, just talk about the vetoes and still some opportunities here. So the anti-trans sports bill, which is titled Fairness in Women's Sports, the governor has until this Sunday to veto. Please let him know that that is something that he should do. Give him your support in that regard. He's been a phenomenal ally and to our community. House Bill 808, because it just passed out, it will be 10 days from yesterday before it is there is a veto. There is a fighting chance with a veto override. We need to let the people in our districts know that they should uphold the governor's veto. We should be targeting anyone that we have a relationship with. We need to flood the legislators that are in our district with our discontent with the passage of this law, even if they voted for it the first go round. And SB 49, that will be going to the governor's desk today. So it'll be 10 days from today. Same there. There was, we know, at least one Republican who did not vote for it. There are opportunities for these to be, for the veto to stand if we make enough noise.
Thanks
That's what
for
I'm
that. Yeah. And again, our website is equalitync.org. We're also at ncisready.org with our Partners Campaign for Southern Equality. And if you go on Twitter, you can find out what we're up to, and we can get into more information there. We really appreciate your time and energy here, and I would love to pass the floor out so we can get into the nitty-gritty of what comes next. Thanks, y'all.
Great. Rebby and Kendra and the whole ENC team, thank you for your extraordinary leadership in the ongoing fight. Obviously, we will all be doing everything we can to defeat these bills at the legislative level. And at the same time, one of our core messages tonight is that we want families to have all the information and resources they need to start making plans and taking steps to ensure that youth have access to the medical care they need and deserve, and continued uninterrupted access to care. Eyeing that August 1 deadline that's in 808, and wanting to make sure folks have all the support they need in preparing for a scenario in which that comes to pass. With that, I'm thrilled to turn things over to my friends and colleagues, Ivy and Allison from the Campaign for Southern Equality. They are going to walk you through the major initiative we are running, the Southern Trans Youth Emergency Project. We are running this project in every state across the South where a gender-affirming care ban has passed or is poised to pass, working in close partnership with state and local organizations and providers to provide direct support and assistance to youth and their families every step of the way to ensure that there are bridges into continued medical care. So with that, we'll turn things over to Ivy and Allison, who will walk us through concrete action steps that we are encouraging families to start thinking about, and also concrete resources that we're making available through the Southern Trans Youth Emergency Project, reinforcing every step of the way that we respect and honor the choices that families make, and want folks to have all the information you need to make the choices that are right for your family and your youth.
Thank you so much, Jasmine. And it is great to be spending time with y'all this evening, although certainly we wish it was under different circumstances. That being said, we absolutely want to make sure that folks leave the call tonight knowing that they're not alone. And even though this is a really scary time for a lot of folks, there are some resources out there we want to make sure you know about, and know that we are in this with you. So first up, I wanted to make sure that y'all know about the North Carolina Trans Youth Healthcare Resource Guide. This is going to be coming soon. It's going to be a living document where we continue to update things as we're in a landscape where things are changing very rapidly, and it can be very confusing to keep up with what the current state of legislation is, and who's providing care and who's not, and what all that looks like. So this will include information about the law, steps that you can take to prepare for the ban as we look to that August 1 deadline, information about how to get in touch with out-of-state providers, because this does not prevent you from seeking care out of state. And I'm joining y'all from the Lower Carolina, where we don't have a ban in place right now. So that is one option for folks, and there'll be more information in that as well as support groups, community organizations. As we know, it's a really difficult time, and we need to make sure that we're showing up for each other and supporting each other.
Yes, thank y'all. I'm Allison Scott. Just tagging on here with Ivy about what you can do right now, because we know taking immediate steps to prepare for this, there are actions that will lead to positive outcomes if you take those as soon as possible. Some of those are getting in touch with providers. Just getting in touch with a provider doesn't mean you have to start any type of medical treatment. It is just making that connection with the provider so you can start discussing your current needs or your continuing care or a future point that you may want to start care. Updating your therapy letters to be current, because we know that it's always a burden for trans, non-binary, LGBTQ people when you're onboarding with new doctors, especially out of state. So just checking in with therapists and getting any of your letters or documentation that may be helpful, getting those refreshed. Get your current prescriptions filled if you have any right now. I know personally, as a trans woman, I've asked my doctor to give me 3 month supplies instead of just a 1 month supply. There's a lot of leeway here that medical providers can do for very valid reasons that will help you in the long run. And also just consider reaching out for one-on-one patient navigation with us to support or for patient navigation support because we are keeping a list of providers and their availability for the states in general. And we do know North Carolina is one of the states, as Jasmine said, at the top that has over 100 open slots right now. And we fully anticipate searching for more and expanding that.
Yeah, which really lends itself to talking to y'all a little bit about the Southern Trans Youth Emergency Project, which we've been running at the Campaign for Southern Equality since these bans have started to take place across the South. And the really sad reality is that if HB 808 passes, 85% of trans youth in the South will be living in states where there are anti-trans healthcare bans in place. But there are still resources out there. There are still ways to get care. And that's why the Southern Trans Youth Emergency Project is here. So we'd love to tell you a little bit about what that is and the kind of resources we're able to provide through it.
When we started the STIAP, I'm going to start using STIAP, it's easier. When we started STIAP, we knew that there were really 3 critical areas that had to be addressed. And it's information support, patient navigation, and emergency assistance grants. So taking these 3 buckets, we know that clear, accessible information is something that we're lacking nowadays in our 24-hour news cycles and Twitter feeds and constant rhetoric back and forth between pundits and different people who are giving out conflicting information. So we are focusing on staying in touch with our partners such as ACLU, Equality North Carolina, QueerMed, and other providers to make sure we are getting really clear information out there. The next thing is patient navigation. That is something newer that I think a lot of LGBTQ people may have seen from reproductive rights. And we are taking that and using it to make sure that people have access to gender-affirming care providers, keeping in touch with clinics who are providing this kind of care, and making sure that people have providers who they can get in touch with that are within ideally 4 hours or less. Now, we know getting to providers is not easy, and that's where the emergency assistance grants come into place. These grants can be used for gas, for hotels, for really any type of need that people run into when they're trying to access this care. And it's not just to get to a new provider, this is even for your current provider. Like I said, using it to fill your prescriptions to bump them up to 3 months' time. So we know that needs to get this kind of care are being served by providing these resources to the community.
Absolutely. So all that stuff that Allison was just talking about has been really helpful for a lot of the families that we've worked with across the South. The grants, the assistance with navigating, finding out-of-state providers or getting into one of the providers who we're talking to see how many slots they have available to get folks started in care before August 1st. And also just information about mental health resources and community groups. If really this is, a really trying time, maybe you're not ready to start yet, but you do need to, find community. You can access all of those things at our website, southernequality.org/North Carolina resources. And that is how you'll get in touch with us, learn more about how to access those resources through STIA.
People often ask, now what happens after I reach out? Because we know oftentimes that when you fill out an application or send an email, that sometimes these things just go out into a black hole and to never emerge. Well, that's not what happens with STIA. When you fill out the application, you will receive an actual email from our patient navigator, and they will start to set up a time to speak with you on the phone. We talk with every single person who fills out an application or sends in an email to get on board. Now, during this call, the patient navigator is going to go over a few things with you. First of all, do you need the $500 grant? Will it serve your needs to help get you to these providers that we're trying to connect you with? Also, what are your child's needs that you need to be referred for a different provider? When we're talking to people, oftentimes they are looking for providers out of state because of the imminent threat of some of these bills. So we're just, when the patient navigator is talking, it's just to assess the needs so that we can connect you with the closest provider to you. And lastly, it's if you're interested in any other resources, because again, if you, like all the other providers have said, that this is just a really fast moving legislative session. These things are changing all the time. Implementation dates are changing all the time. And also, just needing access to things like support groups or other community organizations. We're working with many great partners, and we make sure to refer all of our patients to our partners in our network.
And maybe you're here tonight and you're fired up about this and you want to know how you can support trans youth, but maybe you don't have a trans youth in your life and you're not actively navigating this as a sort of crisis situation with your family, but you want to know how you can help. You can share information about these resources. We're going to have outreach toolkits available soon. You can organize events, check out what's happening at NC is Ready, support our friends at Equality North Carolina, and get involved in your community. Don't forget to tell the trans youth in your life that you love them and support them and have their back, because right now that's a really important message to make sure that we're sharing with folks, because nobody who's here going through this is going through it alone. And just like we always have, our community shows up for each other and has each other's backs and helps fill those gaps when we're in these difficult times. So we're really grateful that everyone was here tonight, and I'm going to throw the ball back to Jasmine to open us up for the Q&A portion.
Thank
And
you, Ivy.
Yeah.
Thank you so much, Ivy and Allison. And just to reinforce with that Southern Trans Youth Emergency Project, those resources are for any family, caregivers, guardians of a trans youth in North Carolina to assist with questions. Those grants are for any family whose youth is having their care impacted. There may be a crisis urgent need around that, but it also may be something that just helps make this time of crisis and turbulence a little bit easier for your family. We have been so grateful to folks who are donating to this grant fund and we want to make sure those resources are moving directly to impacted families in this time. With this, we will conclude the recorded portion of the program. I want to take a moment just to thank all of the presenters who on very, very short notice pulled together this town hall and came together to make this happen. As was so clear, there are a lot of moving pieces, evolving landscape. We will all be working together as partners to continue to move the very latest and best and clearest information that we can to you all at the community level. A quick scan of the chat indicates exactly the kind of questions that any family out there is asking right now. And we will do our very best through the navigation services and through community-based resources like this to continue to get you the information that you all need to make the decisions that are right for your family and your children. So right now we're going to transition into